Not for yet. Okay, again, I'm Donnie Varnell. One, thanks for having me. I don't think I have an accent. You might disagree. So you know I am not from Montana. I know it's beautiful here. And it's really good for me to hear people ready to work. And I know you guys know the problem, and so I don't have to explain the problem to you exactly. But I can tell you this. Why am I here? I think I'm the guy that can show you I started over here, you know, with all good intentions and the best training and experiences I thought I had, and because of this problem, in my world it was the opiate crisis, right? I have found myself sliding further over here, and I'll tell you how I got here, if that helps. And any questions is fine. Now I am mic'd up because I guess you don't have any entertainment in Butte, so you can play this over and over again later. So applause are great, you know. Heck yeah, in the background. Anybody from Duke University? Oh man, what a great place. I like it here better already. There's the hills. Oh my God. There you go. Man, I'm at home. It's my people. Okay, so how did I get here? I'm from a rural place in North Carolina called Wilson. You don't care. I love your ink, by the way. Thank you. But I cropped tobacco all through high school. That's how I got money for clothes. So I understand work a little bit, you know. And from there, I went to college in Texas. I did not go to that place. I went to another school in Texas. That's where I got my degree in criminal justice. So I can read and write a little bit. I know my primary colors, but I'm never the smartest person in the room. So I'm not trying to tell anybody how to do their job. And from there, I went into the military. I was a field artillery officer in combat arms. I jumped out of airplanes for a living for a little while. So I understand some trauma, right? I understand some self-medicating, right? We all have trauma. It's our trauma. My trauma is not yours, and whatever is traumatic to you is you, right? So, but I understand some of that. So I've had some pretty good and bad experiences in the military, and I got injured, so I understand pain medication a little bit. I know how it works. Used correctly, it's great stuff. But then I get out, right? I finally get out of the military, and I go into law enforcement, which is pretty easy transition for most military guys. You know, there's a rank system. You get orders, you're told what to do, you still get to be in charge, you get to carry a gun, you're kind of a bad butt, you get a little adrenaline rush once in a while, all those things, and you really get to help people. And then in law enforcement, here's kind of how this works. From coming back and working the street, because I was a street officer, and I get hired by the State Bureau of Investigation, right? Which is, we think we're the head law enforcement agency in the state, and local guys make fun of us, and we make fun of the highway patrol. You know how that kind of works, you know. I know you guys don't have any in-service rivalries. I don't make fun of the fire department because I don't like fire. I'm a trained arson investigator, but anybody who walks into a building that's burning, they're okay by me. You know, good job, great job. So I get hired by the State Bureau of Investigation. And I do pretty good in the Bureau. I run the sexual exploitation unit for a little while. You know, I'm a homicide investigator. And so I get promoted, probably against their better wishes, but they promote me and I'm in charge of the statewide drug unit, you know, for the 100 counties. And at that point, it was almost all prescription narcotics. That's kind of what I was dealing with at the time. And my story always goes, and for people that heard it, I apologize. I get called up to the AG's office. From the AG's office, we walk over to the governor's office. And I really think, I've arrived, man. I'm going to get the secret, you know, code. They're going to tell me how all of it works. And instead, I got told, well, you know, there's this overdose death thing going on. You need to get a handle on it. So we want you to take care of that for us. Absolutely, boss, no problem. I can do that. Now, I'll take one big step back to 1978. And I was born a long time before that. It's sad how old I've gotten. Is that the laws, the person that talked about laws, the laws for narcotics changed, right, in Washington in like 1978, 1979. Law enforcement didn't have anything to do with that. Just so you know, the term that always is heard, war on drugs, that didn't come from us. That came from legislative works, politicians, and I don't say that in a bad way or a good way, just politics, the war on drugs, you know, Mr. Nixon, all that. We didn't start that. Now, when the laws were passed and came to us, we enforced them with great vigor. I used to say, you know, I chased cocaine like a Cocker Spaniel chases a tennis ball. I arrested so many people for cocaine when I first started. I mean, I couldn't get enough of it, right? We were doing good work, man. We were doing what we're supposed to do. And what I tell people this is law enforcement, good, bad, or indifferent. And I don't know what your experiences have been. Most people don't have. Anybody that has cops come to your house, usually that's not a positive experience, right? We don't show up when the birthday party's going well,
right? It's when Uncle Harry gets drunk again and starts fighting everybody, then we show up and we take care of Uncle Harry, and we still did it wrong, right? So what I tell people this is in law enforcement, I've been all over this country, and I've been in other countries, and all cops have at least 3 things, right? And my fire department brothers, or, well, I mean, I think you're brothers. I'm not, you don't have to say yes or no. But the fire department kind of has the same thing. We all have the training that you mandate that we get, right? North Carolina is different than Montana, I assure you. In the State Bureau of Investigation, my academy was 6 months long, where a local officer went for about 8 weeks, right? But we got the training that you made us get, right? I mean, you guys agreed to the politicians that passed the mandated laws, and that's the training I got. You all we get tools. Everybody thinks of the gun and the badge and the radios and the computers. Well, they're tools, and we use them, right? We do testing on narcotics and stuff, but the tools are also the laws you talked about. That's a tool in my job. I can use it, I have discretion, but there was a time in law enforcement when I first started that if you rolled up on somebody, a truck with 3 guys in it, and there was a half gallon of Jack Daniels and 2 marijuana cigarettes, I had the discretion of pouring the Jack Daniels out and rolling the marijuana cigarettes. I'm not saying I ever did that, by the way. Marijuana cigarettes out, you know, and then go, who's your daddy? You got about 30 minutes to talk to him, then I'm coming by the house, right? And we would turn people loose. Well, that discretion started to disappear in law enforcement, right? Because now if I let you go and you have a car wreck, I'm liable. And if I arrest you, I've arrested young people that now they have a record, and, you know, and so once again, you know, we can't quite get it right. But that's the tools that you gave us. And I assure you that if you change the laws tomorrow that said drug paraphernalia, which is different in every state, but syringes, and if drug paraphernalia was no longer against the law, we'll stop charging people for it, right? And the last thing is direction. Everybody gets told to do something by somebody. With me, like it could be the mayor, right? He'll have mandates he wants the police chief to do. The police chief, the captain, the lieutenant, the sergeant, everybody that lives in my house tells me what to do. So you see, that's the direction I get. I'm sure everybody that has a job, gets a paycheck, has a boss that tells you what to do, right? I will tell you this, with those 3 things that you give law enforcement, we do a fantastic job. I believe that. I'm not anti-cop, nothing, right? We do really well with what you give us to work with. But what I found was this. How did I stop the overdose death rate in North Carolina? What do you think I did? Anybody? Remember, I'm a blue flamer. Say what?
2006 you started.
2006 is when I started. I'm a blue flamer. We're going to work harder. We're going to arrest more people. We're going to make the penalties stiffer. And if I need to build some more jails, we'll build some more jails. Of course, I now know we can stack jails on top of each other, and I'll fill them up all day for you, and the overdose death rate would just keep going. But I did what I was trained to do. That was traditional law enforcement, and I did that, and I really thought I was doing good work. And then at some point, the overdose death rate didn't go down, so I had to look for more tools. And from there, I went to the legislative branches, and we changed some laws. We made it harder to get prescription narcotics, right? I don't know, Montana has the same kind of basis. I've seen some of it, is that, so we didn't have as many doctor shoppers. We were able to do the prescription monitoring programs. We put that on the ground. We put ephedrine behind the pharmacist table so they couldn't cook meth as much as they did. We were doing what we thought we had the ability to do. And we made some difference for a little while. We met with a senator from Kentucky who went to I was there when he called the assistant director of the FDA up on stage and told her, you will be part of you will come to the dinner or you will be the meal. And if you don't know what that means in politics, it means you're not going to get any more of your money, because he controlled her budget. And he did that in front of 800 people in Orlando, Florida. I was there. And eventually, if guys are familiar, when they changed the formula, so Oxycontin couldn't be crushed up and injected as well, right? That came from that, right? And we saw a little dip in the overdose death rate. We thought we were doing good work again. And you know what happened next? Heroin, right? We found oxycodone too, by the way, because oxycodone does a good job also. But so then we had heroin pop up. And I still wasn't getting on top of it. And I kept trying, and I was working my agents into the ground. Anybody ever had that? More cases? Who's caseworkers? I love when you say I supervise every case that involves a child. It's like, then you go home and cry a lot. I mean, I don't know how y'all do it. You know, I supervise all the cases. So same thing. I couldn't get on top of it. And then one day I went to a conference. I met a guy named Robert Childs. You don't care, but he's all things harm reduction to me. If you guys ever heard the phrase harm reduction, he was dressed alternatively. And I knew immediately Robert was not a police officer. He tells a story that I still had my mirrored shades on when I walked into the conference, which I don't think was true, but he says I did. He said, I was very intimidated by you when you walked in, and then you sat beside me. Well, he was sitting with the commander of the SWAT team in Fayetteville, North Carolina. Anybody's familiar, Fayetteville is the home of the 82nd Airborne Division. That is red as red gets. And I knew the guy he was sitting with. He's a cop's man's man. And so he instantly had some credibility with me, right? At least I'd sit with him. And I will always push, so you guys know, it's the message and the messenger, right? How do you get other people to work with you? How do you liaison with other organizations? There is so much talent in this room, it's frightening when I hear you guys talk about who you are, right? But how to get this table to work with that table back there in the back, to find a better way, that's, to me, is the power of this group. It's the group, right? So I meet him, and he starts talking about all these programs. Well, we called it needle exchange to start with. And I'm like, yeah, okay, whatever. Here we go. If you'd have told me in 2006, 2007 that I would have ever even considered the possibility of syringe exchange programs, I would have told you were crazy. And I'd have meant it, right? But he gave me all these programs. Well, here, I understand you're having trouble. Here's what we did in New York. New York. Okay. So it worked in New York. But this ain't New York, buddy. You're in North Carolina now. I tell people we're the buckle of the Bible Belt. And we don't believe in that stuff. If you mess up, somebody's got to punish you, right? You got to be held responsible for your own decisions, right? You can pull yourself, I think Bill told me, pull yourself up by your bootstraps. You know, if you're breaking the law, I show up. But he showed me these programs, harm reduction programs. Who has heard harm reduction? Who thinks you know what it means? Yeah, pretty much. Don't be ashamed. Don't be ashamed. Harm reduction. I tell people my father, flaming alcoholic, basically my entire life. And right at the end of his life, he went from flaming alcoholic to like just an alcoholic. Like he wasn't blind drunk with about 2 days a week. I remember those years as pretty good years, right? Because he had got from horrible to a little bit better, right? That's harm reduction. All right, I didn't know it then, but I was okay with that. That Dad had got off of the whiskey into beer, right? So he told me all these programs, syringe service programs, naloxone. In 2013, no officer in North Carolina carried naloxone on their belt, not one. And that's kind of how I got involved, was that. Robert tells me these programs. He gives me the white papers, the statistical studies. Anybody does statistical studies? Anybody look at the evaluation? Who was the evaluator? Somebody said, I evaluate this, that's where it's at, right? At least in my world, because I talk to police officers, first responders, and municipalities, right? The government. Because you know how to help individuals. And evaluators can show the people that provide the money, does your program work or not? I couldn't go back to the governor and say, hey, there's this program. It's all sunshine and cool breezes, and it worked in New York, and this guy said it worked in New York, let's do it here. He'd have laughed me out of the room. And how much is it going to cost, Farnell? But I was able to take these statistical studies and show that it cuts down overdose by this much. The people that go to syringe service programs are 4 to 5 times more likely to seek services outside the syringe service program, right? Where you might not like that we give needles to somebody, right? But I know now that, do you think anybody woke up on this morning and said, you know, I don't use heroin, but if I could get a clean syringe, I think I would start today. You know that's not how it works, right? Right? By the time I get to the spike or the syringe, I've had a history of using opiates, right, on IV use, right? The syringe is helping me stay healthy and safe, helping everybody I know stay healthy and safe, right? And it took me a while to grasp that. Can you understand, as a police officer, I mean, I thought I was a cop's cop. You needed locking up, and I'm going, wait a minute. So you mean if I let them have unused syringes, it's going to make the thing better? And here's a study that shows it. And every time we put one on the ground, it works. So I had to do it. Medication-assisted treatment. Drug for a drug, right? He says it too. He's much smarter when he says it. And the words are bigger. But, right, that's a drug for a drug in my world to begin with. But then you show me that it's the one thing that really keeps people from overdosing, right? Narcan, naloxone. It took me about a week to learn how to say naloxone. I started by giving free naloxone away. So I finally get through the Bureau. We change all these things. The Bureau says, okay, Donnie, if you says it works, you got the papers, we'll fund it. So we start funding these first programs, naloxone and syringe disposal. Because whoever said paraphernalia in North Carolina, if the little church lady had a Tupperware container of 1,500 used syringes and she tried to dispose of it, if the wrong police officer pulled her over, he'd hook her up for drug paraphernalia. And if he was really cruel, he'd get her for the residue heroin that was in the syringes and charge her with a felony, if he wanted to. So we had to change all those laws. That was the beginning. So I retired in 2015 from the Bureau. I start working for the North Carolina Harm Reduction Coalition because I'm that cop. You know, some cops say I'm the hippie cop. Some coalition people still say I'm a mean cop, so I'm still caught in the middle. It's okay. I'm really good with that. As long as I'm helping individuals stay alive. If you're a police officer or a first responder or anybody in this room, if your number one goal isn't to keep people alive, then what is your goal, right? I mean, I took my oath seriously. There's a reason the cars say to protect and serve. It doesn't say to protect and serve some folks. I tell people all the time, I hear about, especially EMS. I don't think I heard an EMS worker here. In North Carolina, fire responds to all EMS calls. Same here. So basically, EMS light, right? And the burnout for EMS is insane right now, right? Where you're having, I think it's the tragedy of the 5 kids that you all are talking about, heartbreaking. But there are so many places in North Carolina that 5 kids overdosing over a weekend don't even make the newspaper. Right? So it's almost like those kids have raised a beacon for everybody to get motivated to find an answer, right? So we find that in North Carolina the same thing. I can show you programs that will keep you from having to deal with the person on a law enforcement level, right? Deal with them in a judicial concept. Keep them out of your ERs. Everybody that works for these medical facilities, a lot of my funding originally came from hospital medical groups, and it was both. We got free naloxone to give away because they wanted to keep people out of the ED, because it was costing about 12 to 16 grand every time somebody came in the back of the door, right? And so giving us $70 or $2 a dose IV naloxone was money saving. And the fact that it was saving a bunch of lives, well, that mattered to me. So I started by giving away free naloxone, and people thought I was crazy, but I knew all it did was save lives. So now in North Carolina, if you don't carry naloxone as a police officer, you're an oddity. As a matter of fact, there's maybe a handful of agencies that don't carry, right? But when I gave that naloxone away, I was also able to train the agency, and then they get 5 minutes of naloxone training, because anybody ever seen naloxone? You know, 5 minutes might be pushing it for 2 minutes, right? I mean, I can show you how to use it pretty quick. And then we talked about all the other programs. And what I found in first responders is they have dealt with this problem at its crisis point for 30 years, 20 years, 10 years. And they know that the problem hasn't gone away. And they're all doing the best they can. And most first responders that I speak to will tell you they're looking for, is there something else? What I always heard was, give me another option. Give me some place to take them. And that's where we came up with law enforcement assisted diversion, whereas instead of arresting, if I point at you, can we agree you're not a drug dealer or anything? I mean, all right, so I come up on this young lady, and she's holding, right? Because she's always holding, because I know her from, I've been dealing with her for 10 years. And usually she's got 2 bags of heroin and a syringe in her pocket. She's getting hooked up, right? She's going to jail. But with this program, law enforcement, and you talk about a unique concept, I'm going to say we were 4th instead of 3rd. We were 4th. All right, so we're the 4th program in America. We're in Fayetteville, North Carolina. If I come up on her, I can now go, you know, and your name is what?
Lisa.
Okay, Bob. Okay, Bob, you seem like a pretty good person to me. I know your mom and dad. I don't care what it is. But my discretion was, you're a pretty good person tonight. Instead of me locking you up, you're going to go to court 3 to 7 times on the same charge. If anybody doesn't know how that works, that's how it works, right? You're going to be a drain on the court system, right? You're going to be a drain on the medical system because you're going to get out on bond. You're going to be in jail for 72 hours tops. Then you're going to get out. What are you going to do when you get out?
Look for my dear.
You're going to use, right? So you go better chance to overdose? Absolutely. 72 hours out using. So all that happens. Does anybody think she goes to prison for 2 bags of heroin? No, negative. That's not how that works. Now she's on probation, parole. Y'all, everybody's paying for that too. But instead I say, hey, look, I got this program. If you'll sign a piece of paper and you'll promise to go get a diagnostic exam, I'm going to take your heroin. I won't let you keep it. I'm going to take your heroin. You go do that. Put forth your effort. You never get charged with what I gave you. Now in Fayetteville, we were lucky. We had a 24-hour crisis center. I could put her in the car, take her to the crisis center and let her go. And I went back to work instead of spending 3 hours at the magistrate's office. We have magistrates. I don't know what you guys call it here. We have magistrates. And for 3 hours, I had to sit there while they did paperwork and stuff. While if you called for a barking dog call, I couldn't go to it. Now, it could be a barking dog. Here, I guess it could be a grizzly bear. Because apparently they just walk wherever they want to, being grizzly bears. Or it could be a home invasion, couldn't it? But I couldn't go. So when I told this to law enforcement agencies, they suddenly said, oh, that's an option. And I know what we're doing is not stopping it. You gave me another tool. So I think you're at the point where you've got all these resources and how to put all these resources together, right? And how to expand from where you're at now to where can you take these programs. I understand I read your naloxone law. It's good, but there's still some training that you have to do, or there has to be a MOU done. Where in North Carolina, our law basically says I can take a bushel basket of naloxone and put it on that table right there. And as long as you're a human being, you can get as much of it as you want, right? So naloxone works. Naloxone works. Syringe service programs work. 20 to 25% of the people that are in a syringe service program seek services. What other program does that? Right? Law enforcement assisted diversion. If you go in that program, you're 58 to 60% less likely to ever have another negative contact with law enforcement. Do you have a house you go to all the time, boss? Yeah. If I told you I could make you stop going to that house, would you be okay with that? At least okay with it. Without them dying, I mean. Right? Okay. Same thing. Mental health workers. Do you have a frustrating case that you work all the time? A family? If I told you these other programs can enhance what you do, and then that family maybe goes out of your program and goes back into the real world and starts being okay again. So what you're capable of doing is amazing. My last thing is this about first responders. I hear the fatigue. I was touching on the fatigue. And naloxone was the first thing we did in North Carolina. It was really naloxone because it saved lives. We thought it was a pretty easy sale, right? And I don't want you to get me wrong. I'm still a cop. I still arrest people. I arrest people for dealing drugs still because some people make their living off the misery and sickness of other people. I find that disgusting, right? So I still arrest drug dealers. But I do know this about first responders. They get tired of going to the same house. And we have some gallows humor. I know none of you guys never joke about anything that's wrong. And by the way, if there's anything derogatory that's ever been said about a community or individuals, I said it. So I mean, don't think, there's nothing holier about me. I told the last group, crack whore? Absolutely. I used that pretty regular when I was a street officer. I have stood on a front porch annoyed because it was taking the detectives so long to deal with the dead lady that had overdosed. Because we all knew she wasn't a sex worker. She was what? She was a whore, right? She was a hooker. We use all those words. Luckily, the Lord let me live long enough, longer than I thought I was going to live, so I know better. I was able to learn also, right? So, but as first responders, we don't get to choose who we go help. I love that about us, right? So I started with a radio. Now there's computers in the car. So when that bell rings, when that computer goes off, it doesn't tell us how much money is in your bank account, right? It doesn't tell me what kind of car you drove. It doesn't tell me where you went to school. Thank God, because if it said Duke, I don't know. I don't know, right? I don't know. But it just says somebody needs help, and we go to it. And if it means you have overdosed for the 12th time, guess what? I'm rolling to it. I'm giving you naloxone until EMS or fire gets there, and then I'm going to go back on the street and go back to work. Now, when I go back to the street, I might go, man, how many times are we going to go to Larry's house? You know, because Bob has found help now, so we're good with Bob, right? I mean, but we say stuff like that, but we keep going. Have you ever not gone to a call, brother? Ever? Has any mental health ever not health care? Have you ever gone, nope, nope, saw you yesterday, you don't get to come back in, right? And that covers everything, right? Diabetes, heart disease, stomach ache, addiction. All right, so I guess what I'm telling you is this, and I talk a lot. I meant to get a timekeeper because I talk too much. Am I close? I'm still good? Okay, they got no place to go, they can't leave. Okay, did you? I thought you were like, rally on me. Well, that's what that was. I know. So, I know. Is this, I believe I thought I was a pretty normal guy. I mean, I guess most people call me a conservative because I wear a suit and a tie and I'm a cop. I don't know. But I came from that place where it was me and it was the people that were involved in substances, right? And I thought I knew what I was doing. I thought I had the best training available, and maybe I did at the time. But if someone like me can go from lock everybody up to, this isn't working like we want it to work, to, here's these really bizarre programs that are way outside my comfort zone, but they work. And then here I am in Butte, Montana, trying to breathe, telling you the same thing. You know, and when I questions at the end or something. So any questions, any concerns, anybody wants to talk to me in the hallway and argue about it, I'll tell you how it worked for us. And I sell this, sales not the right word because I don't get any money for it, but when I talk to mayors and town councilmen and stuff, I can show them how these programs help your economy, right? Because if Bob isn't dealing with the justice system, then maybe if they're on MAT, they're going to work every day, paying taxes. Their primary care physician isn't the ER doc anymore, right? I can tell medical facilities, hey, I'll save you money if you help us. I can save you money because this clientele doesn't come to your office anymore, right? And I tell law enforcement and district attorneys' offices, you won't be bogged down with as many substance abuse issues, crimes, as you are now if you can get behind some of these programs. Most cops, I find, what really shocked me is cops are like, absolutely. Heck yeah. If what you're saying is true, we'll give it a shot. We get the most pushback. We got a lot of pushback from doctors to start with, all right? They were pushing back at me, and defense attorneys. Why do you think a defense attorney doesn't want these programs to work? Is there a defense attorney in the room? I apologize. I usually ask, right? Hey, honest work. But if they don't have any clients, there ain't no money coming in, right? So these programs work. You're able to use these statistics, and there's a lot of stuff you hear from Andrew, to show that the people that do the funding, that make the policy, that the programs do not hurt, certainly don't hurt law enforcement. And what the mayor said about us being vilified, I mean, there's some truth to that. But most people are pretty respectful to me, I think. They're polite. I mean, I do have a badge and a gun and stuff. I mean, you can only be so ugly to me, right, most of the time, right? But we do know that we have made mistakes. If is there a professional in here that hadn't made a mistake, you tell me. I mean, God bless you, right? We know we make mistakes. We know we don't do it right all the time. So give us the options. Give us the better training. Give us better education so we won't stigmatize people, right? Because I know verbiage can stop a conversation that fast. Oh, aha moment. I have to tell it. Is he looking mean at me? Aha moment is I always get asked this, well, when did you know that it was different? When did you see it? Well, I don't know when that happened. I think I saw it when I couldn't get the overdose death rate down and somebody gave me another option and I just jumped into it. Again, this is kind of how I work. Okay, Lynn, let's do that 100%. Let's get behind it. Let's do it. So we have this law enforcement assisted diversion in Fayetteville. We have a focus group, and I said this to the last group. If you're trying to help a community, and you don't ask that community how to help them first, then I'm not sure what's your program. Good intended. Remember what I said? I started with the best intentions, right? You got to talk to the people you're trying to help, get them into the program, get them into help. How do we help you? So we're having a focus group. It was a large focus group of sex workers from Fayetteville who are about 50% male and female. The male sex workers mostly all do homosexual sex acts, but do not consider themselves homosexual. They just do it because they have to have the money. But could you see some self-medication taking place?
right? Again, I joke again, it's morbid, but everybody played cowboys and Indians when I was growing up. At 11 years old, nobody thought they'd grow up to be a male sex worker, right? That's not what, we weren't playing male sex workers. So you don't start, that's what you want to do. So they come in here and I know they're there. And I'm dressed like this because I don't pretend to be something I'm not. And I see about 3 or 4 of them start walking towards me, right? Now, if anybody's ever, you work in a correctional facility, sir? Is that what you're saying? Okay, you're going to go, here we go. So, and you know I'm against the wall, right? Just staying out of the way, because sometimes we just need to stay out of the way and let you guys do your job, right? And I can tell you later how to get cops to help you do your job and how to let cops stay out of your way. Right, I'm standing there, and here comes these 3 or 4 people, males, dressed alternatively, and I know who they are. I know what the community is, and they start getting a little too closer. Right, they start breaking that 7-foot line. Now they're at like 6 feet. So as cops, you'll know. I told the last group. So if I'm facing Bob here, and Bob's like starting to get in my space, I'm going to blade you. Right, I've turned to the side because I'm protecting my gun at this point. Right, that's the training I get. I do it unconsciously. Like, this is all my important stuff, and this hand is going to keep you up. Eventually, I'm going to do this, like this. Or if I do this now, there was a day they tell me I used to do this a lot. That's close enough there, cuz, right there. Right, and they keep coming, and I'm blading up, and he knows what I'm doing because he's dealt with law enforcement for the last 20 years, right? And he goes, "Hey, we're cool." So, because we understand each other, we've been on the street, right? So I now go, "Oh, okay, let me. I'll get this gun back around here somehow." And he says, like, I've lost everything. I've been addicted to heroin or opiates or cocaine basically my entire adult life. I lost my family. I lost my kids. I lost my job. I lost my house. I lost everything you could lose to include my dignity, right? He said, and nobody ever helped me, not once. Not once. I've been arrested multiple times. I've been to hospitals. I've been to rehab a couple of times, that kind of stuff. I hate saying rehab. And nobody ever really helped me. Nobody really had their heart into it. Nobody wanted to help me. And he said, I never thought that the first person that would ever help me would be a cop. Now, again, I told the last group, angels didn't sing. I didn't hear any music playing. But I realized suddenly I was not only was I getting more out of this than I thought I was getting out of it personally, but I realized this is helping. For this group to get together and come over here and talk to the cop, it helped enough. It was a change, a paradigm shift enough to them to come over and in their own way thank me for what we were doing. So you're doing that work now. You just need to figure out a way to get it all together, right? And work it all, this people get together. And I'll tell you how to get the cops in later if you want to talk about it. Any questions? Or are we going to do them less?
I have a couple questions. Did you do anything legislatively to allow the law enforcement diversion, or was it just an administrative permission?
Law enforcement assisted diversion. Okay, there's no legislative policy to begin with, but by the end of it, we were getting money from the Department of Health to support the programs because they saw all 100 health departments. Who was from the health department? Is this whole table over here? Yeah. All 100 health departments in North Carolina, and to include the State Department, signed on to all our programs because they saw the statistics that we didn't even know about HIV, Hep C. It was just exploding, right? And I didn't go through all those statistics. So we didn't have policy, but we had to call in the district attorney, because the district attorney has to say that we can or can't charge, right? Because he's an elected official, and nobody wants to seem soft on crime. So if you ever deal with officers, one, go to them and ask their input. Don't tell them, here's a program, you need to work it, right? Did we just cover that? Because now that's a different community you're talking to, us. I wouldn't tell you, hey, we're cops, here's what we're going to do. You're mental health workers, this is what I want to tell all your patients. Do this, and then we're leaving, we got to go, right? So, but we saw that the DA had to come in and tell us could we charge or not charge, because they might know stuff on the federal level we didn't know. But we have never, as far as I know, in the state of North Carolina, we got up to 8 programs that I know about, 8 jurisdictions, and nobody has ever been arrested for the original charge, right? So nobody ever went, screw it, I'm out, and we arrested on the original charge. And in Fayetteville, as far as I know, we've only had 1 rearrest of a person that we put into the program. Now, in that program, if they disappear, they still get to come back, right? If somebody was paying $6,000 a month for their private treatment and he didn't show up for a month, they'd let him come back the next month, wouldn't they? Right? You don't have to be substance free to be in the LEAD program either. Right? It's harm reduction based. The trick is to do a wraparound service program of the individual, what makes it right for them. What we found, most people don't have a safe place to stay.
They don't know where their next meal is coming from. Then you get into some want to have detox, but that's not the original thing people need, right? And Mayor, if you ever want to talk about MAT in the jails, that's a different conversation. I'll be glad to tell you how we approached it and the problems and the fears that sheriffs have with the MAT coming into their facility. Yes?
Sorry, can you speak just a little bit about the crisis center? You mentioned it's a 20.
Yeah, in Fayetteville, and by the way, you have a version of that. I guarantee there's something you can do at least during waking hours. So now, crisis center in Fayetteville was 23 hours, right? So you couldn't stay 24 hours straight, or they become a hospital or something. Again, I'm not the medical guy. You don't want to ask me medical stuff. I just knew that for 23 hours a day, I could take them to the crisis center. But what we found is this: we have a thing called TASK. It's like alternative ways to keep people out of jail. It's always in a probation and parole facility. And they would take the people from 8 to 5 and do a diagnostic exam and then set them up for their treatment. Because probation and parole does that anyway. If you didn't know that, I mean, probation and parole sets up these kind of things in most states. Every state I've ever been to, part of their job is to keep you out of jail, right? That's why it's probation and parole. But the crisis center could cover wound care, immediate crisis, like if somebody was going into withdrawals, you had to take them to the ER. But the crisis center basically was just there to do their diagnostic, give them wound care, do some mental health, I guess.
And so by 23 hours, then they were going off to the next service that was going to...
Or they were going home. So the best thing is if Butte doesn't have, or Anaconda or whatever town, say you don't have anything like a crisis center, none whatsoever. Right, you have to find a resource, and there's always a resource that somebody can go to, right, to start the process, right? All I hear is that this is available, that's available. The hospital program just absolutely blew me away that you can just walk in the back door and get Suboxone. Just amazing. In North Carolina, we've been fighting that for 2 years, right? But law enforcement-wise, it means, okay, from 8 to 5, I can move you from arrest to diversion, to divert you out of arrest. So if I get you at 3 o'clock in the morning, you have to come back between 8 and 5. And if you don't, the rules change just a teeny bit, right? Now maybe I can go find you. What we found in the LEAD program for law enforcement is we had a bi-monthly meeting. The police officers, instead of being resistant, became caring, compassionate, and competitive, right? Because if I put Bob in the system, I wanted to keep up with Bob. Because when I went to the meeting, I would get a kind of an update on how her program was going, how she was advancing or not. And I would get a mental health person say, well, I haven't seen Bob and I haven't seen her in like 3 weeks. I don't know where she's at. You hold on a second. And I'd ride around until I found Bob and go, hey, you're missing your meetings. I'm just saying. Now, she doesn't get arrested for that, right? That's not how harm reduction, law enforcement, assisted diversion is supposed to work. It's like, hey, do you need a ride? Because they'll get somebody to come get you. You need to get back in treatment. You're going to slip up again. And we know that from law enforcement assisted diversion, if Bob slips up, if she's on probation and parole, and she slips up, she's not telling probation, right? Because she's going to get violated. So she continues to slip. And 14 days later, she'll end up back in my world, one way or the other. Overdose, petty crime, violence, trespassing, possession. She's coming back into my world. But in law enforcement assisted diversion, she knows that she doesn't get arrested. She'll pick up the phone and call mental health and go, I messed up. Had a football game. Denver lost. Panthers lost too. It's okay. It's okay. You thought Denver was going to win, though. I knew Panthers weren't going to win. So she says, hey, look, I slipped up. And they'll get her right back into treatment that fast. And that's better for her, right? So, yes.
I had a client Monday whose young guy was trying to get convinced to go to treatment. He was adamantly against it. And one of the things he said to me was, we need to stop arresting us. Mm-hmm. And I can see where this would just be so helpful.
Yeah, I mean,
the diversion, to smaller stuff, of course. But,
absolutely. It does. I'm sorry, he raised his hand. Yes, sir.
I was following lines with her, so I work in the criminal justice system, and fortunately or unfortunately, people in the system have far greater access to services than people who are not in the system. And we don't have a crisis 24 hours, at least that I'm aware of, in Anaconda. So if I'm in supervision, we have what's called non-residential ETSS, so we can refer somebody for drug testing, employment, counseling, all the above, mental health evals. If you're not, if it's my next door neighbor, and that's what I run into a lot, you know, it's either me trying to get a hold of MC, DC, or SMART to get somebody into treatment, or creating a makeshift sober living bed, even though we don't have room. So I was curious, like her, on the crisis response 24-hour program, just all that mental health and CD counseling and employment and collaboratively, I think that's really a lacking piece for adults or maybe, and maybe for kids as well.
We don't do juveniles because they have to be 18 to sign a contract. That makes sense. Do you have to be arrested to be in your program? When you say in the system?
Yes.
Okay, and non-residential means I've got charges, so I have to go to that facility.
Be post-adjudicated. You got to be at some level.
Gotcha, okay. And getting hung up on the crisis center, we have rural areas that don't have anything like a crisis center, right? So they have a mental health office, right? And you know all the resources. I point at you because you thought this was a good seat when you got here. It's not. And so I get them, as an officer, I have to get them somewhere, right? I have to make sure, one, they're not a danger to themselves or others at the moment, and I can cut him loose if he signs that piece of paper. In my jurisdiction, every community is different. Some communities only do marijuana charges, right? Which I think is not the best way to do it. And some communities like Fayetteville has worked its way up to trafficking charges, right? There's some parameters, and that's a whole nother presentation. But I can get them, hey, you're not getting arrested tonight. Go home. I got your stuff. You have to be at her office tomorrow between 8 and 5. If you don't show up, she's going to know. She's going to call me, and we're going to make a decision what to do to you. Don't think I can't find you. I mean, is it extortion? I don't like to call it that, but it's keeping you out of jail. Because to start with, it took us a year to get the program off the ground, really, because people don't believe it. They called it the snitch program in Santa Fe, because they just thought if the cops were helping you, you had to be an informant, right? So it takes a while for the program to sit. So I get them to her office the next day, and then she puts the program together, right? You know who's at all these other tables, don't you? Supposedly. I mean, I'm giving you a lot of credit. So. Right. I'll move to the next table. I'll give you a break. All right. So, but she knows all the resources we discussed for the last hour. And she's going to put you in that program. She's going to send you where to get clothes, where to get a resume done, where to get a job, where to get food. If you have to have emergency housing, she knows that. I'm a cop. I don't know. I don't want to know. I don't want to know. I don't have time. I got to fill out a report from this, right? So, but that's her job now. So don't get hung up on there has to be this magical. Santa Fe has a one-stop shopping 3-story building. Has everybody that's in this building is in that building, top to bottom. They walk them in the front door and it's all taken care of. Most places don't have that. So you get everybody in a room with law enforcement, because it says law enforcement assisted diversion, right? With law enforcement, and you make a plan, and then you tweak it as you go, right?
I'll just make a quick comment. We don't have those crisis centers in Montana because Medicaid hasn't reimbursed for them, but they are updating the Medicaid plan right now, and within the year, you will be able to bill for 23-hour, 59-minute crisis services and for mobile crisis services. And you don't build services unless you can pay for them, and so they will be billable, and they will. And from what I heard from Melissa Higgins, they're looking at a pretty good rate with CMS right now, and so there's a lot of potential to build. And like Helena has the Journey Home, Billings has a crisis center, but we're actually going to be able to bill for 23-hour, 59-minute crisis with it by 2023.
Buttes is back open.
What?
As far as I know, Buttes is back open. You can,
Yeah, but the big thing to me, you got to be able to bill for it. You got to,
is it Silver House or Dakota House? I don't know if they renamed it.
They've opened and shut down a bunch because there hasn't been funding.
They are back open, and people can walk in to get stabilized.
But I don't think they're allowed to walk in often. They're sent then to the emergency room for medical clearance. But that's another topic.
And even in places that don't have a 24-hour crisis line or 24-hour crisis center, program that we started in Appalachian County in Maryland had the chief and the sheriff. We asked, are there times where your officers don't have tools other than arrest, where that's not what's helpful? And they said, yeah. And I said, what do you think should happen in those times? So Donnie said, you get with law enforcement in your jurisdiction, you make a plan. And so we asked him, what do you think should happen? He said, I think they should be sent to a peer. And we had a harm reduction program that we funded in that location. We said, if we add 2 peers to the harm reduction program, would you call them and send folks there and instruct your officers not to arrest? They said, yeah. And so the key with LEAD as compared to other programs is it's non-coercive and it's person-centered, person-directed. So instead of saying, I want you to go to treatment, so you're going to go to treatment, and if you don't go to treatment, you're going to go to jail. 1 in 10 Americans have access to the treatment that they need, and there's not a lot that can surprise me in this area anymore. But if you look at, it's one of the recent years of the National Survey on Drug Use and Health, and they have a graphic with overlapping circles. And one circle is how many people in America have a substance use disorder. And the other circle is how many people in America have access to treatment. And about half of the people in treatment do not have a substance use disorder because we use coercive methods where that's not even what's appropriate. So
True.
we have not enough treatment, and the way that we're allocating it is not based on who's ready or who wants to do it. And so the key with LEAD is if Donnie puts me in LEAD, I go see someone do a biopsychosocial assessment, and I say, what do I have to do now? And what they say is, you don't have to do anything. And they say, what do you want to do now? And I say, well, I don't have an ID, and it's really messing up everything. And so we work on an ID, right? And so it's because it's those two things that differentiate from other things. You can do it with a crisis center, you can do it with peers, you can do it with a bunch of different ways. But basically it's a mechanism to have officers have other tools than arrest, and to have a venue to work with officers to have them see it work. We did it also not just because it's a good program, but because it's the most potent tool I've seen for culture change amongst law enforcement. In some communities, law enforcement are going to be the gatekeepers, not just of arresting people, but also of the opinions of the rest of the community, right? And so those are a couple of pieces. Any last questions for Donnie, and then we're going to move on.
Can I just say that we do have the Angel Initiative in the state of Montana, which Governor Gianforte did put in place, which is not exactly the same.
I can come to the office and
But it is, you can bring in, turn in, and you will be connected with treatment. I know we have beds, I think Rimrock has beds.
kind of started in Nashville, North Carolina, a little bitty town. And it's a great program. I'm a big proponent of it also. With the LEAD program, you can also have what we call social referrals, which means people can come and say, hey, I hear you got this LEAD program. I'm in trouble all the time. Would you take me? Or somebody can refer somebody to law enforcement. The original plan was so that it was at that critical moment of arrest or not arrest, and to keep people out of the system. The Angel program works really well in the two places I know about it, as long as the champion is there. As long as the chief is the champion, they will continue to go there. And it's the one in North Carolina was faith-based, which is almost free, turns out, if you know who to call. So the Angel program, what she's saying is people can come in, and it originally started, I had to bring my substances and my paraphernalia and turn it in, and the police would actually be the people that took me to, in this case, the detox center. There was a detox center, and get me started on another path. And then it turned into I could just go and say, look, I don't have anything on me, but I really like to get in the program. And we had people flying in from California and Alabama and stuff to Nashville, North Carolina, which is a teeny little town, to turn themselves into the front office because they couldn't get a bed. So that's anyway, and I've taken a lot of time. So.
So I think we'll go ahead. So we're caught between a cop and a priest here, so I figured I better get Andrew in here.
I'm Scottish. That's something. I'm close. I'm not exactly a priest, but I can act like one if you want me to.
Well, I'm going to listen to you. You're the guy, So, Andrew, I think I'll go ahead and get you going.